Well, Mark and Ashley, this hearing went on for about 3 hours today here on Capitol Hill, and it got off to a pretty contentious start with a protester interrupting Kennedy's opening statement. But Democrats quickly challenged Kennedy on his leadership and his reshaping of federal health agencies.
Health and Human Services Secretary Robert F. Kennedy Jr. defending his decision to fire the director of the U.S. Centers for Disease Control and Prevention.
We need bold, competent, and creative new leadership at CDC, people able and willing to chart a new course.
The hearing before the Senate Finance Committee was scheduled to focus on the Trump administration's 2026 healthcare agenda. But on the heels of Kennedy's ouster of former CDC Director Susan Monarez, Democrats quickly slammed his leadership and his longtime claims against vaccines and how that undermines public trust.
Sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines.
Two Republican physicians expressing concern about the Trump administration's changes to vaccine policy. John Barrasso of Wyoming saying Kennedy isn't upholding vaccine standards as promised during confirmation.
The public has seen measles outbreaks, leadership in the National Institute of Health questioning the use of mRNA vaccines. Americans don't know who to rely on.
Bill Cassidy of Louisiana critical of new FDA limits on COVID-19 vaccines.
I would say effectively we're denying people vaccine.
Kennedy argued current policy doesn't deny anyone a COVID-19 booster, although it is now state dependent, and he defended his controversial moves to reshape government public health agencies.
If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job.
Even with some Republicans on the panel expressing concerns about Kennedy's leadership, the White House this afternoon releasing a statement in which they praised Kennedy's testimony, signaling they are standing by their top health official. Mark and Ashley.
Well, now, Karen, several senators on the committee told Secretary Kennedy that information on vaccines is becoming more confusing, especially for parents. Talk to us about their concerns.
Yeah, well, you heard Senator John Barrasso of Wyoming, a physician himself, tell Kennedy Americans don't know who to rely on. And as Kennedy undertakes this rapid reshaping of what public health agencies look like and the information they put forward, a number of the senators expressed just how confusing it is, right? For years, Americans have been relying on agencies like the FDA and the CDC, which are both under Kennedy's purview at Health and Human Services, for the gold standard of information. And Democrats especially were skeptical of some of the information that Kennedy is putting forth, the people he is aligning himself with, and most importantly, the people he is putting in top roles at these agencies. Now, any administration is allowed to put in the personnel that they want. That's how this typically works. But the main concern, especially among Democrats, came from the science or the theories, really, that Kennedy is relying upon versus some of the data that longtime professionals have put forth.
Karen, you're talking a little bit about this shakeup here, but talk a little bit about Kennedy's defense of that recent shakeup at the CDC and then why he felt it was necessary.
Well, Mark, this is part of his Make America Healthy Again vision that Kennedy has talked about and that President Trump found very persuasive when he named him to this role. Kennedy has said that these agencies need a dramatic reshaping, especially in the wake of the COVID-19 pandemic. You heard him today sharply critical of the public health officials who came in the previous administration. He used the word liar a lot and said that the American people were being lied to on many fronts. And now senators on the panel disputed that and some of the information that Kennedy was putting forth. But Kennedy clearly wants to put people in these roles who align with his beliefs. And Democrats in particular on the panel said that is very dangerous because Kennedy has been an activist for anti-vaccine movements. And so they find that very disconcerting as Kennedy moves forward in this role.
And that becomes an echo chamber.
Well, Karen, we thank you so much for your time today.